Hello and welcome to my YouTube channel once again. If you're a returning subscriber, thank you for your support, and if you are new, please don't forget to hit the subscribe button and turn on the notification bell so that you will know whenever I post new videos. Today we're going to be talking about something very common among women. This affects a lot of women of childbearing age and above. It affects pregnant women, it affects teenagers, it affects middle-aged women as well. So it is very common in our environment. In Nigeria, it is known as commonly as toilet infection. Well, toilet infection in quotes, because toilet doesn't give you the infection per se. You don't get it from the toilet. We'll come to that when we talk about the causes. But we'll be talking about vaginal candidiasis. Vaginal candidiasis is very common. Like I said before, it is common among women. It is not sexually transmitted. So, what causes vaginal candidiasis? Before I talk about causes, what exactly is vaginal candidiasis or vulvovaginal candidiasis? It is a lower genital tract infection, usually caused by fungus called Candida or Candida albicans. Candida albicans is the species that is responsible for about 80 to 92% of vulvovaginal candidiasis caused by Candida albicans is about 80 to 92%. There are others, I wouldn't bother you with their names. So let's talk about the causes of vulvovaginal candidiasis. Or what are the predisposing factors? What are the things that could make you prone to developing vulvovaginal candidiasis? One is pregnancy. Pregnancy gives a woman a sort of reduced immune system or a suppressed immune system. It is not a disease. Pregnancy is not a disease, but this reduction of immunity is physiological. It's due to the state of pregnancy. There are a lot of hormones involved in it. So we'll not bother you about that. We'll talk about other causes as well. That includes, aside pregnancy, diabetes mellitus. Diabetes mellitus, if you are diabetic, you're prone to having vaginal candidiasis as well. Another common cause is immunosuppression that I've already talked about, the one caused by pregnancy, but this I'm talking of generally. Maybe you are on immunosuppressant drugs, and maybe you have HIV that reduces your immune system. Maybe you have tuberculosis, other things that are opportunistic that comes when you are immunosuppressed. You might develop vulvovaginal candidiasis. Another cause of vaginal candidiasis is douching. Douching refers to washing or irrigating the vagina in an attempt to clean it. Now, you don't need to do that. You don't need to clean your vagina with soap, water. Some people use very harsh soaps and detergents. Some people go as far as applying perfumes. These are irritants that might lead to tipping of the acidic pH of the vagina. It would eventually lead to opportunistic infections like vaginal candidiasis. So you don't need to wash the vagina with substances, either soaps or apply perfumes. The vagina itself is self-cleaning. It doesn't need your help. It's self-cleaning. You can clean the outer part. The outer part, that's the external vulva. You can clean that, but you don't need to clean the inside. Another cause is indiscriminate use of broad spectrum antibiotics. Should not be taken indiscriminately. It should be prescribed by your medical practitioner. When you're taking it, when you're in need of it, you should make sure it is prescribed for you and for a certain condition, and you are supposed to take it completely. So please do not go and self-medicate with antibiotics. You might clear out the natural flora or the natural bacteria that is resident, that is beneficial and resident in the vagina. If you wipe them off with antibiotics, you might end up inviting opportunistic infections that will come and invade and lead to candidiasis. So indiscriminate use of antibiotics. We've talked about vaginal douching. We've talked about condition of diabetics, mellitus. We've talked about pregnancy as well, and immunosuppression. These can cause or predispose you to having vaginal candidiasis. Let's talk about how would you would know that you have vaginal candidiasis. How would you know? What are the signs and symptoms of vaginal candidiasis? What are the signs and symptoms? What would you see? The first sign or symptom you might experience is vaginal itching. Infection causes an itching in the area. So the itching results from the irritation from the infection itself. The itching involves the outer part, the vulva, So when you itch and you scratch, the scratching might lead to local swelling of that area and redness of the area as well. So I advise you do not scratch or itch. Instead, go see your doctor immediately. Number two symptom you might notice is vaginal discharge. The discharge is usually cheesy or curd-like. It's like cheese. Coated cheese is whitish in color. It drops spontaneously on its own. So that is the second symptom you might notice. If the discharge is greenish or smelly, it indicates bacterial vaginosis. So it is better you see your doctor as well. So you might also experience dyspareunia. Dyspareunia simply means painful sexual intercourse, especially the external part of your genitalia. When it becomes painful, that might be a sign that you have candidiasis or any other genital infection. So it is better you go and see your doctor. Another symptom is dysuria. Dysuria is pain when you urinate. Pain when you urinate. Pain is usually felt in the external area. So these signs, if you experience painful urination, painful intercourse, if you experience vaginal discharge, whitish discharge, if you experience itching, vaginal itch, please go and see your doctor. Your doctor would listen to you, your complaints, take your history and examine you and send you for appropriate tests that would help him to diagnose the particular condition and rule out those that are not. So he rule out bacterial vaginosis, he rule out trichomoniasis, rule out other infections that might be similar. So if he diagnoses candidiasis, vaginal candidiasis, he's going to place you on some antifungal agents depending on your condition. If you are pregnant, your doctor would prescribe vaginal antifungal creams or pessaries that you can apply either once or continually for 6 days depending on the type. There are antifungal agents including Fluconazole, Clotrimazole and the rest of them. So do not self-medicate. Go see your doctor You prescribe what is necessary for you to take. You prescribe what is appropriate for you to take. So go see your doctor. If you are diabetic, you might want to screen you and see how you're controlling your glucose level, which is very important. A good glycemic control is very important. Then if you are neither pregnant or diabetic, he want to counsel you further on avoiding things like tight fitting. The same advice I'm giving you now. Avoid tight fitting synthetic underwears made from synthetic material. I prefer you use cotton materials that are cotton underwears are better off. Then another thing you should avoid is vaginal douching. You don't need, I've made the point before, you don't need to clean your vagina yourself. It cleanses itself out. You can clean the external part with water, and that is enough. Also, it is not sexually transmitted, so you don't have to treat your partner, your sexual partner. But if you are having recurrence of this condition, your partner might need to be treated as well. Then you also have to avoid indiscriminate use of antibiotics. Do not self-medicate with antibiotics. Get a prescription from your doctor. See your doctor, let him treat you. Then going back to douching, do not also use harsh soaps when you're cleaning your genitalia. You can use water, which is okay. Do not apply perfumes or perfumed creams. This will lead you to contracting candida infection. Please, if you found this video helpful or educative, or if you enjoyed this video, if you have learned anything at all, please hit the subscribe button now and give this video a thumbs up so that it pops up for other people to view as well. And please hit the notification bell so that whenever I post another video, you will be notified. Thank you very much. See you in my next video. Thank you. Bye bye.